Thank you very much, Mr. Chairman. I think I speak for everyone on the Republican side in expressing our gratitude to you for holding this very important hearing. I've said it before and I'll say it again. I believe we in this subcommittee have a great example to pursue real bipartisan solutions for the American people, and this hearing is one of those opportunities. As you mentioned, Mr. Chairman, this is a real issue, a crisis that our military and veterans are. We are seeing more suicides on the rise. Recently, 3 veterans killed themselves over 5 days at VA facilities in 2 different states. 2 of our veterans took their own lives in the parking lots of Georgia VA medical centers. My constituents back home are being significantly influenced and affected by this growing crisis, and I know all Americans around the country feel the same way. It's not just a Georgia problem, as we all know. This is a widespread issue touching so many in our communities. It impacts our friends and families as well. These men and women who volunteer to serve our country and keep us safe and free are suffering. And now is our time to stand up and address some of these real concerns. We have to do something. That's why we've asked the 5 of you to be here with us today, and we appreciate every one of you for being here and the expertise that you bring to this committee. It's time for us to try something new. I think it's time for us to try something different, and I look forward to hearing your comments on this. Congress has provided billions of dollars to the Department of Defense as well as the VA, yet the number of suicides from veterans between 2008 and 2016 averaged 6,000 per year. That's a stunning number. Suicide is a complex, multifaceted issue, and we must tackle this public health crisis with new ideas. I'm pleased to know that both the Departments of Defense and Veterans Affairs have made this a top priority. But it has to be more than just talking points and more than just fancy new strategies. Today, I want to hear how you're all working together to address this, and Ms. Donelian, you as well, and I say that as an inclusive aspect here. I look forward to hearing from you as well. We've got to have a comprehensive approach, and it'll take all of us working together to address this crisis. I want to know what programs the DoD and the VA have initiated and how you're going to tackle the issue and track the issues. I want to hear examples of something that didn't work and how you're now adjusting appropriately. Where have there been missteps and how can we address that? The American people expect us not only to spend money wisely, but in this case, certainly to save lives. If there are programs that are working, then Congress needs to know about it. We need to see some change. We know that many men and women fear coming forward for mental health care because of fear of judgment, being passed over for promotion, or affecting their security clearances. This is unacceptable. Today, I want to hear how we are working to change the culture so that these men and women feel safe to seek help. As we have learned in recent years, the best way to address this crisis is through a holistic approach. So today, I hope that we hear more about what that looks like. How are we alleviating stressors related to finances, health care, transitioning between active duty and veteran status? Ultimately, our objective here is a bipartisan one, to prevent suicides and take care of our veterans. In the last few months, President Trump signed 2 executive orders to deal with the rising rates of veteran suicides. The executive orders are intended to increase coordination and prevention efforts among all stakeholders, federal, state, local, and nonprofits. Our servicemen and women need to know that when they return home and transition to veteran status, they are connected to family, to health care, to one another, and to all the services they need. So we've got a lot of questions today, and I hope that today we're going to hear some good answers. So again, I want to thank you, Mr. Chairman, for holding this hearing. I want to thank our witnesses again for your expertise and for being a part of this hearing today, and I look forward to hearing from each of you. And with that, I yield back.
Mr. Chairman.